Dr. Puren, good morning. And before we talk stigma and get to the Health Minister's concerns, let's have a squiz at these latest figures and just looking at the total number of tests that have been conducted, 356,067 COVID-19 tests, and looking at the number or the jump that we see in infected cases. Are we testing enough here in South Africa?
So that has been, I think, the crux of the matter. I think that we started off at a very low base of testing, but I think the experts would agree that, in fact, at this particular moment of the epidemic, we certainly are testing at a very high rate, and in fact, that rate is what I think some of the experts said we should be doing. I noticed Professor Salim Karim, for example, said that, in fact, we should not be reaching even higher than that. But it's critical to be able to be testing in order to understand the nature of the epidemic. And so you've seen different strategies in the different provinces to really try and understand the epidemic. So, for example, I'm sure you've discussed some of this before, but I just want to emphasize when you look at the Western Cape, for example, they have a dual strategy of community-based testing as well as targeted or focused testing where there are outbreaks, for example. So the community-based testing is showing us a low level of coverage, about 3%. It's starting to climb, but I think that's because of the Western Cape data. Whereas I think when you look at the Western Cape, there's certainly an exponential growth. So testing is really key. It continues to be a key role in terms of our understanding of the epidemic.
And just looking at the numbers we're seeing coming out of the Eastern Cape of late, Doc, I mean, is that really a cause for concern now, not just the Eastern Cape, but if we look at other provinces that are mostly rural as well? Can we say that the worst is yet to come, or that we did not concentrate on them enough earlier, despite the low numbers we are seeing in some of them at the moment, where some of them we even have zero deaths, you know, like for many provinces, a couple of them have zero new cases and zero deaths as well?
Yeah, so my view is that we need to be vigilant. In other words, my sense is that perhaps the community-based testing in those particular areas is of no real contribution or no major contribution. But I think we do want to understand what's happening there. But I think my view is that perhaps the serological-based testing would tell us a bit more about that. I think what is critical now is as we see this exponential growth, and it's likely as the lockdown is removed through the different phases, we are certainly going to see a marked increase in cases. So there, it's critical for those particular provinces to really focus on when you've identified an individual who's infected to be able to do the necessary tracing and tracking, testing and isolation of those particular individuals to really close down in terms of transmission. And so that would be the advice that I would give.
And just to look at this latest number, the number of confirmed cases so far jumping by 637, is that a cause for panic at the moment?
I don't think it's panic. I think that what many of the experts have also said is that we expect to see this with the lockdown, the change in transition, the greater mobility of people, that we're going to see an increase in cases. I think what is critical is that we remain responsible as a community at large. In other words, we still practice that physical distancing, the hand hygiene, the etiquette around sneezing and coughing, the wearing of masks, the cleaning of surfaces, the preparation of workplaces and schools. These are the key things that I think we need to emphasize day after day. However boring it may seem, however we don't wish to comply, but the more we comply, the more likely we are to try and flatten that curve. In other words, distribute the numbers of infections over a longer period of time, rather than seeing an explosion of cases. But if we don't adhere to that, we're going to see the explosion of cases in workplaces, in malls. If you don't have to be at a mall, don't be at a mall. If you're unwell, stay at home. If you can work from home, those are the key elements that I think we as a society need to adhere to.
How big a part, Doc, do you think that, with us going into winter and temperatures dropping almost daily, how big a part do you think that is going to play? Are we likely to see an even bigger jump in infections at this time of year?
Yeah, so I'm very pleased that, in fact, we're talking about the physical distancing, the isolation, the hands, the cleaning of hands, and so forth, because we're also entering into the flu season. So, in fact, we're going to have two outbreaks. We're going to have the coronavirus outbreak and we're going to have the flu season. So it's really important because those viruses more easily transmissible in closed confines. In other words, when we are in close contact for long periods of time, that's when we see transmission occurring. So yes, that can certainly and will contribute to what we're saying, but we're also going to be seeing the flu season take off as well. So again, there are things that we could do, which we've already emphasized, but in the case of the flu, and I'd like to really encourage those individuals of high risk, especially our healthcare workers, pregnant women, those patients with cardiac disease or hypertension or diabetes mellitus, be vaccinated in order to at least stave off at least one of those particular infections.
And, you know, Doc, we also tend to compare what's happening in South Africa to other countries. I don't know whether it's to comfort ourselves or whether we're giving ourselves a false sense of security to say, oh, look, we're not as bad as what Italy was, or the US, or, you know, Spain, for example, wherever it is that the numbers exploded and are continuing to explode. But is that... Can we compare? Can we say, yes, we're better off because these numbers are so low, but looking at the size and the populations of those countries as well, China, for example, as well, should we be comparing? I'd just like your take on that, or are we giving ourselves just that false sense of safety and security?
Well, it could be the other way around. In fact, it's a learning process. In other words, each country has its unique experience around the epidemic. We can certainly learn from some of the areas that have certainly occurred, for example, by stopping testing or testing too late. So I think we have our trajectory. Our trajectory is not necessarily unique, but we have added problems in our country. For example, we have a huge proportion of our population, over 7 million people are HIV infected. 5 million of those are on treatment. That means there are 2 million people out there who may not know their status, or who do know their status but are not on treatment. So I think we should not try and compare ourselves to other countries when in fact we have particular unique problems that we need to face up here. We've got TB to add to that particular problem as well. So no, I think we need to be vigilant. I think we need to be cautious. It'd be nice to think that we can compare, but I think we really need to be cautious about those comparisons.
Okay, Dr. Adrian Puren, thank you so much for your time.